I, bedside whiteboards are really important to me actually, because I think that it gives people a place where they feel that they're safe to be able to give their feelings and opinions and understand what's happening with their care. It gives the person that is being cared for in the hospital a sense of belonging. This is their space. If the whiteboard is there, it's got their name on it. It's got their nurse's name on it, hopefully their doctor's name on it. And so then that gives them the feeling of belonging. I belong in this hospital. Somebody is here to take care of me and look after me, and I have a say in that.
When patients and families are unable to communicate with the healthcare provider, it really does impact the care. It impacts sometimes the trust between the healthcare provider and the families and patients, and in some cases can even cause compromised care, which can then impact the patient's health.
There's a lot of cultural barriers that come into play, especially for individuals that might be immigrating to a new country. It's a very new shift in environment, and a lot of the times our healthcare system, we're supposed to build that trust, and we do our best. And so something like the whiteboards, it's just a way that we could empower them.
To look at the whiteboard before you enter a room or before you address the patient or you start talking. Identifying the patient themselves, right? So usually, ideally on their whiteboard, you have a preferred name, right? Which is versus what the given name is, which can be easily checked by looking at the wristband. But again, beyond that we don't want it to be very transactional. We want it more relational, right?
If they can walk in and see that person's name on the board and acknowledge that that person is in that room, which many times doesn't happen. If you just walk in and say, hey, hi Fred, how's it going? And then deliver the meal, that makes such a huge difference emotionally for the patient to believe that they're being seen.
One of the ways that the bedside board could be used is implementing a languages spoken section, which would outline the language that the patient speaks or multiple languages that they may communicate in. And this could help the healthcare provider to facilitate communication effectively and ensure that there is trust built between the patient and the healthcare provider.
It would help the caregiver and whoever is looking after, and the patient and the essential care partner connect better with each other, all three branches of what's going on.
It also acts as a communication tool for the healthcare team so that they're able to communicate with essential care partners and the patient as well. The patient is also able to then identify different goals that they're working towards, as well as dietary preferences, which are very important, and then can also focus on different milestones that they've accomplished during their stay at the clinic or the hospital. If the essential care partner is not available during the doctor's visit, they can use the whiteboard as a visual aid and as a tool to their advantage, and have any questions that they may have, they can write those down on the whiteboard.
The information that the patient wants to convey, whether it be like a preferred name or if there's any inabilities or any hindrances or any preferred ways of, let's say, communicating one side of the bed versus the right side of the bed.
It would be really nice if you were able to send a message to, say, the doctor, because the patients don't see the doctors very often, nor do the essential care partners. But if you have some particular reason that you want to see them, it would be nice to be able to write down, would it be possible to get an appointment with the doctor? When are the rounds done? Can I come in and sit in on some of the rounds?
In a way, we end up empowering individuals. We also promote that autonomy for the patient to be their own self-navigators and make those important choices for themselves.